Continuing with Objective 7, now we're going to define, pronounce, and spell behavioral health terms. Starting with the ones built from word parts. Psychiatrist, physician who studies and treats disorders of the mind. Psychiatrists have additional training and experience in prevention, diagnosis, and treatment of mental, emotional, and behavioral disorders. Psychiatrists often prescribe medications for patients with these disorders. Psychiatry, specialty of the mind, branch of medicine that deals with the treatment of mental disorders. Psychogenic, originating in the mind. Psychologist, specialist of the mind. Clinical psychologists have graduate training in clinical psychology. They administer psychological tests and treat individuals with disturbances of mental, emotional, and behavioral disorders by counseling therapy. Psychology, study of the mind, a profession that involves dealing with the mind and mental processes in relation to human behavior. Psychopathy, any disease of the mind. Psychosis or psychoses would be plural, abnormal condition of the mind, major mental disorder characterized by extreme derangement, often with delusions and hallucinations. Psychomatic, pertaining to the mind and body. And then the behavioral terms not built from word parts. We have anorexia nervosa, eating disorder characterized by a disturbed perception of body image resulting in failure to maintain body weight, intensive fear of gaining weight, pronounced desire for thinness, and in females amenorrhea, which would be absence of your menstrual cycle. Anxiety disorder, disorder characterized by feeling of apprehension, tension, or uneasiness arising typically from the anticipation of unreal or imagined danger. Attention deficit hyperactivity disorder, disorder of learning and behavioral problems characterized by marked inattention, distractibility, impulsiveness, and hyperactivity. Autism, spectrum of mental disorders, the features of which include onset during infancy or childhood, preoccupation with subjective mental activity, inability to interact socially, and impaired communication, also referred to as autism spectrum disorders. Bipolar disorder, major psychological disorder typified by a disturbance in mood. The disorder is manifested by manic, which is elevated or irritated mood, excessive energy, impulsiveness, and depressive episodes that may alternate or elements of both may occur simultaneously. Bulimia nervosa, eating disorder characterized by uncontrolled binge eating followed by purging, which is making themselves vomit. Major depression, mood disturbance characterized by feelings of sadness, despair, discouragement, hopelessness, lack of joy, altered sleep patterns, and difficulty with decision making and daily function. Depression ranges from normal feelings of sadness resulting from and proportional to personal loss or tragedy through dysthymia, chronic depressive neurosis to major depression, also referred to as clinical depression or mood disorder. Obsessive compulsive disorder, disorder characterized by intrusive unwanted thoughts that result in the tendency to perform repetitive acts or rituals or compulsions, usually as a means of releasing tension or anxiety. Panic attack, episode of sudden onset of anxiety, acute anxiety, occurring unpredictably with feelings of acute apprehension, dyspnea, dizziness, sweating, and or chest pain, depersonalization, paresthesia, and fear of dying, loss of mind or control. Phobia, marked and persistent fear that is excessive or unreasonable, cued by the presence or anticipation of a specific situation or object, such as claustrophobia, which would be the abnormal fear of being in enclosed spaces. Pica, compulsive eating of non-nutritive substances such as clay or ice. This condition may be a result of an iron deficiency. When iron deficiency is the cause of pica, the condition will disappear in 1 to 2 weeks when treated with iron therapy. Post-traumatic stress disorder, significant behavioral health disorder in which some people exposed to a traumatic event go on to develop a series of symptoms related to it. These include mentally re-experiencing the event, increased autonomic arousal, which is the fight or flight response, avoidance of thoughts or activities that are reminders of the trauma, social withdrawal, and difficulty making emotional contacts with friends and family. Schizophrenia, any one of the large group of psychotic disorders characterized by gross distortions of reality, disturbance of language and communication, withdrawal from social interaction, and the disorganization and fragmentation of thought, perception, and emotional reaction. Somatoform disorders, disorders characterized by physical symptoms for which no known physical cause exists. And I'm going to end the recording here.